Hello, I'm Dr. Herrington of Herrington Family Chiropractic. I posted a video a couple days ago of myself adjusting a patient, and it immediately started getting some responses of what the heck are you doing? Why does it look like it hurts? We want an explanation. So that's what I'm doing here. I'm going to show the video up in the top corner here, but I'm going to give a quick explanation on what it is that I'm actually doing. The whole video is actually sped up. I did cut a whole bunch of points out of me actually positioning and figuring out what to do, so there is some editing to the video. Don't worry about that. The first thing the first manipulation I do, or adjustment, is as I'm laying the patient down, it is to correct a movement disorder in the patient. So it is in the thoracic spine or in the more middle of the back. My hand is placed behind the patient, and as I'm laying the patient down, you see me drop a little bit with the upper half of my body. What that is doing is putting force through the chest of the patient, through their spine, using my hand as a fulcrum to block particular vertebrae to restore motion in that segment. It is very, very common for patients that sit for a living to have a lot of stiffness in the mid-chest, as we tend to hunch when we sit for long hours. The next one you show is the one that people absolutely love to cringe at when they see it actually done, but it feels fantastic, is a neck adjustment or cervical spine adjustment. And what that is, in this case, it is fixing a right rotation restriction, or in common sense terms, patient couldn't turn to the right nearly as far as they needed to, or there was some restriction or pain, dysfunction, I guess, in that movement pattern. So as they were turning, they had a little bit of pain. So you go through, find the very particular vertebrae or a couple vertebrae, plural, adjust those as per needed, and they then have a full range of motion after the adjustment. The last one is a lumbar, where I'm bringing the leg up, hold the shoulder, and I'm dropping my entire body. What you don't see is I am pushing inward very, very little. And when that happens, I am causing a rotation as well as bringing the leg down with me as I go. I rotate the spine just a little bit to again cause a segmental dysfunction or somatic dysfunction. A couple of vertebrae don't move as well in the lumbar region, and they happen to just kind of vacuum seal together. They kind of lock, causes some regional discomfort. And this patient, it again was on the, it was actually on this particular video, it was a left rotation. So as I was going through adjusting that, you see me drop very, very quickly. It doesn't pick up on camera too well. Again, the whole video is sped up, so there's a bit more finesse in how to position the patient for that. But that is what it is. Those are three standard chiropractic adjustments. They do not hurt. If they're done properly, there should be no pain, no discomfort. You should get immediate relief of the symptoms, or reasonable immediate relief. It is slightly common for there to be a little dull ache the next day in some patients, particularly ones that are very, very tough and rigid and kind of gnarly with their muscle tissue. But that's all there really is to it. That's what I do on a daily basis, and patients really tend to love it. If chiropractic care is not for everyone, so don't think that I'm going to say this is fix all, do everything. Doesn't work that way. Works very good things for, or works very well for the things that it works for, not for everything. So if you do have any kind of movement disorder, this is one of the things that we do, one of the things I do very well. So come on in, check it out, and we'll see you around. Thank you. Have a great day.